Welcome to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry, straight from the experts. I'm Eon and I'm chatting to Dr Clifford Yudelman from OptiSmile once again as we take a deep dive into the world of dental care from a consumer's perspective. So whether you're looking to brighten your smile or just protect your wallet, we've got you covered with practical advice and the latest insights with this podcast. So do stick around with us. And in today's episode, we are talking about kids at the dentist, how to build a fear-free foundation. So whether you're gearing up for your child's very first checkup or just looking to turn nervous jitters into confident smiles, Dr. Clifford Yudelman from OptiSmile has all the practical tips that you need. Let's just say hello to you, Dr. Yudelman, before we dive in. How's it going?
Great, Eon. Thanks for having me back. Some nice weather in Cape Town. We're waiting for some rain in the next couple of days. Yeah, let's see what happens with the weather. But in the meantime, looking forward to this episode. We get a lot of mothers asking us, about their little kids. And I thought it's about time to now focus on some kid episodes rather than doing 3 in a row. Our first one today, I think, will help a lot of people, and then stay tuned for a few more kids ones down the road. Not next week, but in the near future, yes.
Okay, so doctor, what is the ideal age for a child's first dental visit?
So a lot of authorities, the American Association of Pediatric Dentistry and other authorities like that, recommend that by their first birthday or around 6 months of the first teeth appearing. Sometimes that is a little bit young. It's ideally, we a lot of the kids that we see of that age at OptiSmile are where the parents have had Invisalign with us, the mother generally. And then they get married and then they get pregnant, and then we see them during their pregnancy, and then they ask us, when should I bring my kiddie to the dentist? So we'll usually recommend that first visit, or when they're in the shopping center. We're at the point in Sea Point, just to bring the kid in to say hello to everyone and to leave, just like not a big deal, just so it's not, they don't associate it with a medical doctor, because every time they go to the doctor, they get something with somewhere, maybe in their mouth or who knows where, or a vaccine or injection. They got to realize that the dentist is different to the doctor. I mean, it does look quite different. Early visits like that turns, the dental surgery or the dental practice into a familiar and friendly place rather than a scary one. They usually, when they're small like that, they can sit in the mother's lap and we can just play with them and chat. And we usually, when they laugh or giggle, we can get a look at their teeth. And normally it's to give the parents some direct advice. And, we make these visits gentle and playful, and that sets the stage for a lifetime of confident smiles.
Okay, and what can parents actually do at home to make going to the dentist more fun and positive?
We tell the moms, talk about the dentist as someone who helps little smiles grow strong, like a superhero for teeth, to use fun language, like, the mirror is like a magic looking glass or a magic mirror, or Mr. Bubbly is the spray. We make it sound like a game. I get the moms to shine a little torch or flashlight for overseas visitors into their mouth and use a back of a pen to count their teeth and to pretend to do a tooth counting game. This is when they're a little bit older, to get someone else, to get a friend to count their teeth. So they get used to opening their mouth wide and counting and getting bright light, shone in their mouth. We tell them to avoid things like hurt or needle. Don't keep saying to the kids, "Oh, don't worry, he's not going to hurt you," or "The dentist isn't going to give you the needle or give you an injection." By saying things like that, you're just preparing them, and your own anxiety is projecting onto them. There are lots of colorful dental story books, for role playing, where the family fun, like I mentioned, like role playing a checkup ahead of time. Those are some good tips before bringing kids. that all works well when they sort of a bit older than that 1-year-old type thing. When they're around 3 or 4, they tend to come to the dentist, have a lot of fun.
And at OptiSmile, what unique steps do you take to put the little ones at ease? Can they watch cartoons or anything like that?
No, we don't have cartoons or anything. It's more like getting involved with them. So we start off with basically with a show and tell session, letting the kids hold the mirror and look. That's what I usually do. I first start with the mirror, I open the packet. I don't have mask or gloves on, and I give them a little dental mirror, and then I let them look at their face in that little mirror, and I say, "Who's that?" And they go, "Me," and it's all kind of fun. Sometimes I actually take out my phone, I get them to open their mouth wide, and I take a picture with a flash, and then I show them, and I say, "Whose teeth are those? Oh, look, how many do you have? Do you have any teeth at the back?" You're just kind of playing a game. We let them hold the suction, the small suction. The big one's quite noisy when it's turned off. And we fill a paper cup with some water, and then we tell them, "Oh, it's going to make a big noise now. Let's turn it on." And they kind of jump a bit, and we get them to suck all the water out of a paper cup, and they love that. We keep there's water splashing everywhere, and they're suctioning the water. And then we use the air blower. We tell them it's like a hair dryer, and I'll blow a little bit of air on their hair, and blow it on their hand, and then you can blow it on their cheek, and they tend to sort of jerk away. But you get them used to it. You don't go and put these things in their mouth, and you can get an idea for how scared or not so scared they are. And we tell the mom. So sometimes I'll start even outside in the waiting room. And the other dentists at OptiSmile are very, very good with kids. They use similar techniques. This is what we were taught at Wits. Most of us here were trained at Wits. Then even in the room, we don't like sit behind them and put on mask and gloves and expect them to just open their mouth. We do a lot of this playing games with them. Sometimes even before they even sit in the chair, we give things a name, like I mentioned, Mr. Mirror, or the magic sponge, or Mr. Thirsty for the suction.
I love that.
Yeah, the photos creative. With the cell phone are great. Yeah. And then I kind of play with them because I've got a foot control for the chair, and I tell them we've got a magic chair, and I say to them, talk to the chair, say up, and then I use the foot control, and it makes the chair go up.
I love it.
And then I put my hand on their shoulder, and I say back, and then they get a fright because the backrest goes back, and then I say stop. So they feel in control.
Oh, that's brilliant.
And then they get a lot of them. They're too clever these days. The kids, they look around, they see me pushing on the foot control. And these days you get dental chairs, I'm sure, that are voice controlled.
Yeah,
hey,
pretty
Google.
Much. Yeah, but I like that. That's
Google
very nice.
Play Bohemian Rhapsody is my usual one.
Yeah, oh, is it?
Yeah, look, and then we just get them really. The first visit is to really get them involved and like make everything really cool. Yeah, I tell the parents don't help. So if usually the mom brings kids in for some reason. Maybe dads are working. I'm not sure why it's always the mom. If the moms are very nervous, sometimes they realize they're best off to stay at home, and then the dad will bring them in. And I say to the mom, if it's the mom, say, just ignore us. Don't try and help. You just sit quietly, pretend you're checking your phone, your WhatsApps, or your Facebook. Don't, like, if I have to repeat something to the kid, don't try and help me. Let me try and communicate with the kid directly myself, so we build a rapport and a relationship. You just sit quietly. What I tell them, don't, like, if I'm going to sit the kid back, don't go and grab their leg or their hand, like projecting your own fear or expecting them to be scared. I also tell parents when they're having kids not to talk about scary things. We did this when we spoke about dental fear. A lot of people are scared of the dentist, not even because of their own experience, but because of something they heard about from a friend or their parents talking about something like this. And I'm sure you've got more questions. I don't want to jump the gun. Let's see what else you come up with here.
But Dr. Yudelman, any words or descriptions that parents should, avoid using, especially at home? And maybe, the kids are always listening. So what should you avoid saying or talking about?
Oh, yeah, that's the worst thing. They try and, because they're scared, they use words like drill, or like if we're in America, the word shot. People, are you going to give me a shot? Even the little kids, or needle or injection. I think in South Africa, we just say injection. We don't use the word shot. So we tell them not to say, oh, the dentist isn't going to give you a shot, or the dentist isn't going to give you an injection, or he's not bad. They really, it's best just to, we're going to go visit my friend. Look, he made my teeth beautiful. When you come back from the dentist, to have a little present that maybe the dentist gave you. So we don't bribe them. We will reward them afterwards, which I'll get to, but we don't have a toy or something there and say, if you're good, we'll give this to you afterwards. Then they're like, oh, something's going on here. We don't talk about treatment. Terms like checkup is more positive, or a smile visit. Well, I just like to say counting the teeth. So if I'm busy looking at their teeth, which we'll get into shortly, I just keep counting as if I'm counting their teeth. And talking about counting, I'll ask them in the waiting room, how many fingers do you have? And then we count 1, 2, 3, 4, 5. And then we say, and the other hand, 1, 2, 3, 4, 5. And I say, how many toes? And, and it's like a real giggle. And then I say, so how much is 10 and 10? And some of them will get the answer depending. I say, that's 20. You think you got 20 teeth? And they go, oh, I don't know. And I say, come on, let's go back. Let's go count your teeth. I bet you may have 20 teeth. So it's very, it's a lot of fun. I do enjoy seeing the little kids early before they have any cavities or problems. And we keep a focus on celebrating a healthy smile rather than on particular procedures.
And I also want to ask you, Dr. Yudelman, what's the role of a parent or a support person during one of these appointments?
Yeah, like I was saying, a calm parent in the room can give comfort and reassurance if a child is, for some reason, nervous. If they're going to hold the child's hand or keep their hand on their foot, it's best that they just let it rest there. They don't squeeze like every time they think something may hurt or bother. It just makes the kid feel like the parent is close. That would be more if they were coming back for treatment, say, without any sedation or anything. If the kid is, if it's an older kid, like six or so, or 5, say, and they're acting up when the parent's in the room, sometimes we might explain to the parents ahead of time in a case like that. The kids often do much better when the parent isn't in the room, especially when the parents when they don't listen to you and they start butting in and trying to help too much. Like, just keep still. They start getting aggravated, or the dentist doesn't have time for you to be so scared. You know? And then they start scaring then we kick the mother out, and the kid will often just calm down and do whatever we ask.
So you remove the mother.
So yeah.
Do you phone security, or how do you?
Yeah. So pediatric dentists will often get kids that have already been through an experience like that at the general dentist, or the parent might have taken them to 3 dentists already and report that the kid kept biting the dentist's finger. And a pediatric dentist, the first thing they do is they kick the mother out, or the father, depending who the problem is. We always debrief, speak to the parent afterwards to highlight anything that was positive and to reinforce it at home. Like, not to say next time don't bite the dentist's finger, or it's just like, oh, you were so good, he managed to count all your front teeth. Maybe next time you'll let him count your back teeth, just positive reinforcement. Yeah.
Okay, well, that's a great approach, and that certainly works well for everyone. But also, is there any simple behavioural rewards that work best afterwards for the kids?
Yeah, we have all kinds of toys that we give them, little games and things at the end of the visit, just as a little surprise. If they're going to come for regular, for a few visits, a little chart with stickers sometimes works. Over the years, I've been doing this 42 years. I used to see a lot of kids in Australia and America. In the practice at OptiSmile, we've got 7 rooms, and I've got several associates and some female associates. The females are generally very good with kids. So I don't see as many of the kids anymore myself, but we've got some very good associates that are really great with kiddies. A new toothbrush and their favorite color, non-sugary treats like sugar-free gum is very good for their teeth. Consistency, building a reliable and a positive routine really works.
Okay, and then also, how do these early visits prevent anxiety in later years, Dr. Yudelman?
Yeah, that's the main thing with these initial visits. The first visit at least should be very upbeat and positive. That sets the tone. They get familiar with the sights and sounds and routines. If they got an older sibling, the sibling that if the sibling is good, they come along and the older kid, say the older brother, jumps in the chair and demonstrates. It's called modeling. Lay back, open their mouth, and we sit them up. 1, 2, 3, count their teeth. Then we give the older kid a little toy of sorts, and then you say to the little one, "What about you?" And they just want to do the same thing. It works also getting the mom to, like, if the kid's really for some reason nervous, we just ignore the kid and we just count the mother's teeth, and then afterwards we don't force it. If they don't want to get in the chair the first visit, we just like, okay, we'll see you next week, and that's the end of the visit. We don't push it. And this, if you can get them to be positive about going to the dentist early on, this really pays off. Building trust and a routine early sets the standard for how they'll approach their dental visits in the future as they get older.
It really does. I mean, I can still remember a day where I went to the dentist as a kid, and I actually bit the dentist, and I remember all the drama surrounding it, and up to this day, I still, because my dad wanted to, club the dentist after he said to me he's going to club me. But so you see, it sticks years later, like 30 years later, and it still sticks, eh? So it's very important these years, what you experience. But what options exist?
So I just want to say something about that, because I practiced in California from 86 to 2002, and I'll never forget a cute little Mexican kid who was always very, very good at the dentist, and he wasn't scared. And his name was Jose, and little Jose had been in those days, especially with some of the Mexican kids and Filipino kids and some of the lower socioeconomic groups in California. They ate a lot of drinking Coca-Cola and eating junk. And sometimes if the kid had to come back for one filling, they had to come back 3-4 times, because we do a little bit at a time. And this little kid had been in 2 or 3 times, and he wasn't scared at all. And then the one day he had a bit of a naughty look on his face, and I was doing something, and he just bit down kind of gently on my finger, but not gentle enough that I couldn't get my finger. He was just sort of gnawing on it, where he wasn't biting hard, and he was like growling like a dog. And I remember, and he was just smiling at me, and he was like, "I got you this time." He just wanted to play. Yeah.
Oh,
and
shame.
I'll never forget. Yeah, he didn't hurt me, but I just it was classic. And another story with a kid. We never leave the patient alone, but for some reason, I think I stepped out of the room back in those days. I used to go and check the patients. We worked with several dental assistants. It's different in California. And I stepped out of the room to go and check a patient. And for some reason, the nurse got up to go fetch something. They normally will stay with the kid. And we heard this screaming, and the kid's going, "Nurse, nurse, nurse." And then everyone started running to see what was going on. And then she walked in the room, and he said, "Nurse," and she said, yeah, what's the problem?" And he said, "Nurse, I love you."
Oh wow! Okay, I didn't expect that.
Yeah, it's a good story.
It's cute, man. It's nice to remember these things years later. But also, I want to ask you, Dr. Yudelman, what options exist if a child remains fearful? I mean, I suppose medication is not an option, is it?
Yeah, so we don't have nitrous oxide or inhalation sedation at OptiSmile, but there are practices, pediatric practices, and general dentists. There's some very good ones that specialize in nitrous oxide sedation for small procedures with kids. We don't like to give kids oral sedation. There are sometimes you can give an antihistamine or a very light sedative if they're a little bit nervous, but if you still have to numb them and that, and it depends on their level of how much treatment they need and what they need. Some people recommend headphones or cartoons, but I think that's just a distraction. A lot of the time, if the kids are anxious, they're very anxious because they've already been somewhere else. So we love to see kids that have never been elsewhere. If they've been somewhere else and had a few bad behaviors, then we'll either refer them to a pediatric specialist, or like I said, some of my associates are very good with sedation cases, and we bring an anaesthetist in. We've done a few podcasts on sedation, and the kids, if they need 4 quadrants of fillings rather than bringing them back 4 times, if they get sedated, we can numb basically all the areas. The anaesthetist keeps the kids safe and wakes them up. There's not a full general anesthetic, basically reverses the sedation. The kid doesn't even know what was happening, and the parent just has to keep an eye on the kid because the mouth is numb. And then they don't have a bad experience, and then they want to come back in 6 months to get their teeth checked. They don't even remember anything. So that works well if someone needs extensive work. But otherwise, gradual desensitization. If a kid needs 3 fillings and there's a small one on the top left, it's very easy to numb using the wand, which is a special machine for giving anesthetic that doesn't hurt, and it works really, really well. So you get them back in. Usually it's easy to get them back in if they have a good experience.
Yeah. Okay, and now Dr. Yudelman is going to share the top 3 take-home tips for parents between visits. Dr. Yudelman, what have you got for us?
Yes, so doing role-playing, like I mentioned, every couple of weeks, use a spoon as a pretend mirror, use the back of a toothbrush, or a pen if it's clean to count the teeth. Just do that on a regular basis. Brushing together using a timer app, or even one of those old-fashioned egg timers for 2 minutes, making it routine and fun. And then also reading some of these story books. There's really good little books you can buy online, or these days you can even find them. And there's cartoons on YouTube about kiddies going to the dentist. There's all kinds of fun things. So I'll leave it up to you.
Fantastic. Dr. Yudelman, thank you so much. That concludes our podcast today on kids at the dentist and how to build a fear-free foundation. We appreciate your time as always, Dr. Yudelman, and we look forward to next week.
Thank you. Looking forward to it as well.
A big thank you also to our listeners for tuning in, and remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe to the podcast for more enlightening discussions, and join us again next time as we continue to explore the fascinating intersection of dental health and also financial savvy. Until then, don't forget to keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.